The greatest impact of the funding cut has been an initial closure of HIV services like testing, viral load sample collection, and also a closure of youth-friendly activities like kids clubs. And this led to overburdening of the already constrained frontline health workers. There was also the widespread shortages of ARVs, and of course, this led to a lot of interruption in treatment.
There were no longer any staff at the clinics to link moms and children back into care. This included counselors, included community health workers, and also even at household level, we could no longer be able to test as many moms, as many children. We could not identify moms who needed antiretroviral therapy, who needed to be engaged in care.
There's been disruption of some preventive services for HIV, as well as outreach services. A lot of clinics have been closed, which were supported by partners, and we foresee a gap in retention and also in finding children in the community through HIV testing being a problem.
It means it's integrating care where people can access HIV treatment, mental health, and sexual reproductive health services in one place without judgment and without barriers.
It's a shift towards expanding health insurance coverage and making it mandatory that children and adolescent services are explicitly included in the health insurance scheme. We should scale up integration of HIV services with other services, for example, maternal and child healthcare services.
One way is thinking about making sure that financing can support and finance the integration of HIV services at primary healthcare level, at district level, at provincial and referral hospital. The second thing is thinking about national health financing insurance scheme. And we know many of these are being rolled out in Africa.
We need to have a healthcare provider who's equipped with knowledge, commodity to use on our clients so that they are managed properly. In short, we need trainings for healthcare providers.
Every person, each sex worker, each woman, each adolescent, girls and boys, they deserve to be heard, they deserve to be cared.
My hope is that they will live and grow healthy, they will be strong and they'll be confident, and that they will not have interruption in their services, that they will live without the fear of waking up one day and have their medicines interrupted.
I am very hopeful for an AIDS-free generation, and I just hope that we are able to forge together. And we are here as ECPAF, and we are really calling on others as well to just join us in keeping our promises for children, for moms, and for their families.
So we should not give up. We should continue with our campaigns. We should continue with fundraising for funds. And secondly is that isolation and exclusion does not stop the epidemic, but rather it is us to stand up and push on, because we said our goal is to stop AIDS by 2030.
We should have a future where no child is born with HIV. We should have a future where there is universal access to HIV prevention, care and treatment. We should have a future of adolescents who are empowered to take a lead, to live a healthy life and demand for services in an HIV stigma-free environment.